Hi, this is Dr. Anilak. I just celebrated my 63rd birthday along with Margie. Oops, did I say that, Margie? Sorry. And so during this celebration of that, I'm going to actually make myself look younger with Botox. The reality is, I was looking at the video that you see on our homepage, and I was looking at myself, and I'm going, man, those are deep craters in your forehead. I thought, man, I'm getting looking old. So being that I've celebrated 63, I'm going to make myself look at least 62. So we're going to see how that looks. So we use Botox for migraine headaches, and also we have called trigger points where we can go in the trapezius muscle down here, which can help with migraines and headaches. And actually, I have a headache, so she's going to actually take care of my forehead and make me look better because I don't have a headache. So this is Dr. Rosenthal, and say hi.
Hi, how are you?
And so she's going to be going ahead and doing this. She's really good at it and is going to make me look at least 62, if not younger.
All right, so first we started by cleaning the area that we're gonna treat. Turn towards me just a little bit. Thank you. So we're gonna do forehead and 11s. So we just clean this area. And then we're just gonna mark how active our muscles are, which you can see his muscles are very, very active. First we're gonna do our 11s, so make a grumpy face. And this is what we have to deal with every day.
You mean me as a boss, or me just being
face.
grumpy?
Make it again.
So she's marking where she's gonna put the little injections, and then it takes a
Another
little
one.
while. It takes a little while for them to start to work where the muscles become more relaxed in those areas.
Now make surprised face. So now we're gonna mark where his forehead injections are gonna go, and relax, and make surprised face again. The way I can see which part of the muscle is more active, now you can relax again. And just start marking. We don't wanna do our forehead injections too close to our eyebrows, otherwise we're gonna get droopy eyes.
Oh,
We don't want that.
no.
So
Well, how many are you marking up?
I feel like we need a lot of help here.
Ain't that the truth? Oh, I'm so glad it's my birthday.
All right.
So you're putting it in which part of where the surprise, where the droop is? So where it creases, or the high point where it doesn't crease?
It kind of goes everywhere, but wherever it creases more, we'll just put a little bit more. You can relax now.
Okay.
You're gonna delete my marks.
How many do you have?
I think we have 23 dots right now for the
23 dots. Oh, I see myself in it. Oh. Very good.
All right, and we're gonna go ahead and start here.
This doesn't hurt at all.
I'm gonna turn the light on and you can close your eyes.
Gladly.
Usually we just start with our 11s.
So are those the corrugator muscles?
Yes, they are.
So this is, it feels like just like a little pinch. That's all. And the difference between this and what we do for in the bigger muscles is this is a fast. You do it fast, and the other ones we when we give an injection for dental purposes, we go slowly so it doesn't hurt. I know that's a difference for that. And then when we do things for the headaches and the migraines, especially with the stuff that radiates up to the side of the face, is we'll do what are called trigger points, and we find those are the little knots in the muscles that sometimes when we feel those and press deeply, it radiates up into the side of the head and where those headaches are coming from.
And so sometimes we can take care of those where we break them up with we actually put a needle in there. It doesn't hurt, but we break them up, and then it helps relieve headaches that come to the side of the face and in the neck and things like that. So little different purposes. And in those cases, we use Botox just to help relax those muscles in those deeper areas. We also use lidocaine to help numb that area up a little bit to do it. But that's different than what we're doing today. Actually, I'm being a filler right now.
So we put about 1 unit for each dot. That way we put a pretty good amount, but it's spread all the way around,
Yeah.
as opposed to putting in just few spots. The way we make sure we hit the muscle all around and we don't get any overactive parts.
That's a really good point.
If a part of your muscle is not moving, then the other part of the muscle is gonna overcompensate and move too much.
Mm-hmm.
So we wanna hit it everywhere.
Yeah. So when you only do a few or less of them and add more to them, it gives you more of a crooked result. It's not flat, right?
Mm-hmm.
Okay.
Usually we ask our patients to come back in about 2 weeks so we can make sure that muscles are symmetrical and then we got the result that we want. We always start with a lower dose just to make sure that we do not over freeze your muscles. We still want some movement.
Yeah. So Botox, it basically makes the muscle inactive. And how long do you recommend coming back for this?
Everyone is different, kind of depends on personal preferences.
Mm-hmm.
I'd say anywhere between 3 and 5 months. Also it depends on which muscles we're trying to freeze. If you come in for TMJ muscles, we usually start with a larger dose.
Absolutely.
But you actually don't have to come in as often.
Right.
There are some patients that do it only once a year.
Mm-hmm. Yeah, I did mine a little while back, but over time it does wear off, and so you have to have that redone to get a natural appearance. I might even look 61.
Okay. All right, well, I think that's about
Hey,
it.
Marge. This is my partner in
In birthday.
birthday. Say hi, Margie.
Hello. I'm hiding my
Are you
wrinkles
next?
with the mask.
Are you next for your birthday? Should be.
I need plaster.
Just wait, I'm gonna look 61 soon.
I know, that's not fair. I was gonna ask if you were gonna come do an exam. Those black dots on your forehead.
It was target practice for a shotgun. Just kidding, people. All right, so what are you doing now?
We're just cleaning you up.
You're
The
done?
yes, we
was
are
fast.
done. The main point right now is if you wash your face, you manipulate your skin at all, you're moving it away from your eyes because we don't want Botox to go down and affect your eye muscles.
Yes.
And that's how you get droopy eyes as well. And we just try to stay away from anything that makes you sweat for the next 2 days. Otherwise,
Really?
the Botox just gonna evaporate with your sweat, and
So I
it's
play
gonna be
hockey.
less effective.
Wait a minute.
So
I play hockey tomorrow morning.
Well, I guess no hockey for you tomorrow.
No!
And we're done.
Probably if I wear my helmet, I have pressure on my forehead. Thank you. It was easy.